having a joint work session with the Board of Health, Archuleta County Commissioners. This meeting is all by Zoom, I understand. We're present here at our office and everybody else is present from their office or home. So thanks everybody for coming. Excuse me. I think where the chair is, if Ann wants to do a roll call. Or we vote over it.
Good morning. This is Amber Z's. I'm currently the chair of San Juan Basin Public Health Board. I think this is my last day of running meetings. My time expires in November, but calling this meeting to order. Roll call. I'm Amber Z's, and I'll let each board member identify themselves.
Erin Daniels.
Carrie Bird.
Carol Peterson.
Marcia Porter Norton. Oh, I'm sorry. Marcia Porter Norton.
Bob Ledger.
And then of course, Alvin has a dual role, but so with all of San Juan Basin Health directors being present, do any have any potential or perceived conflicts of interest based on the agenda today?
No. I have none.
No,
I have none.
I don't either.
I don't have any.
I pass back to you, Commissioner Schaaf.
Okay, thank you. I guess we're down to, well, I guess it's still your approval agenda and content. This is just a work session, so I don't know if we need to do that unless you think so, Ann.
We typically do. So from the standpoint of our board, what we could proceed to do that. Is there a motion by any of the board members for San Juan Basin Health to approve the agenda as presented?
I make that motion to approve the agenda as presented.
I second.
Yeah, okay, but everybody's on the ball this morning.
Any discussion? Hearing none. All those in favor, say aye.
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 Any opposed? Thank you for entertaining that for San Juan Basin Health. Commissioner Schaaf, I again pass back to you.
Thank you. Okay, number 5 is the future of the San Juan Basin Public Health District. So, excuse me. Where do you want to start?
Yeah,
Questions?
I guess it's not necessarily a question, but more of a statement. Just from my perspective, as you know, we have seated a health district investigation committee because we are trying to find or make a decision on what is going to be best for the citizens of Archuleta County. And in my view, that does not disclude us from continuing a relationship with San Juan Basin Health. And if that's the case, that's great. But whatever is best for our residents here, the folks that depend upon a healthcare district, we need to determine what that is. And I'm hopeful that we can come to some type of an agreement or resolution in whichever way that we end up moving to do, again, what's best for our community. So I appreciate all of your input. I appreciate your willingness to be here today. And also I appreciate the fact that you met with our investigation committee and you were able to answer the questions that they presented to you. So thank you.
I have to concur with Commissioner Brown on this. I know there's some other issues out there that have been very contentious within our area, Archuleta County, as well as not only just with this one county, but I know other health boards have had issues in other counties and some have changed, formed their own and established their own. But my main intent here is just the cost, being diligent to our community as far as the increase in the expenditures and getting further transparency as far as the increase in the expenditures to Archuleta County and what it's going to cost us and whether it's fundamentally viable for us to either start our own, stick with San Juan Basin Health or the possibility of joining another organization, but that's upon the investigative committee to make a recommendation after they finish their investigation and see what they can render to the Board of County Commissioners in Archuleta County, their best recommendation.
Yeah, I sound like a broken record, but I think that's my feeling as well, that just do what's best for our county. And I think it's probably on us. I know we presented a resolution to the San Juan Basin Board of Health in 2020. And we got responses, and I think that we didn't follow up on the stuff that we were asking for, because I believe in the responses said it could be provided upon request. So maybe that's on us for not getting the stuff that we asked you guys for. So I think maybe just better communication, and then, we're going to have to go with whatever the recommendations are from our committee.
When you guys sat with the committee and had a conversation with them, I haven't heard back from our committee yet. The questions that they had asked you, were they all satisfactorily answered to the committee?
I guess.
I was there physically, and I felt that it was a really productive, positive experience. And I actually enjoyed meeting the committee and hearing, what they had to say and just talking things out. I haven't heard back. I would think that if there are still some questions unanswered, that they would contact us back, and we haven't heard anything since that meeting. So I thought it was good. I thought it was productive. There was a lot of information exchanged, and so I'm glad we did it. I'm really glad we did it.
I would agree with that. I was present via Zoom. This is Ann, and Leanne was also present via Zoom. The committee had some very good questions. I think we provided some detail. I don't know if you want us to provide any level of overview on that. Your statement was, or Commissioner Schaaf's statement was, that maybe there are breakdowns in communication. And I guess when I think about process more than anything, how we get here, and it would be great if what you all decide is best for, and we totally agree. I don't think there's a single person that doesn't think that it's not appropriate. We all agree it's appropriate for you to assess what is best for the county and how to best deliver those services. There's zero disagreement about that. And if you decide that staying with San Juan Basin Health is best for the county, maybe we can work through ideas, or the boards can work through ideas that will help improve communication. Maybe there should be a regular, whatever amount of time annually that the two boards meet in the way they are. Perhaps you would want to receive staff presentations. The board receives staff presentations. They've been quite focused on COVID this past year, but they've always been actually quite in depth about the services that are provided. They're extremely educational. The folks that provide services actually are very good at presenting about the services that they provide in the community. And so it may be, I realize you have a very busy job with running an entire county, but it may be that you want to receive that. I'm just thinking ahead if there are ways to solve communication barriers.
Okay. I know one of my biggest hangups was back even probably 5 years ago when I was appointed an alternate to the San Juan Basin Health Board. Serving Michael Whiting was supposed to be the head person on that, and then I was the alternate. And then all of a sudden, the bylaws got presented or brought up, whether, I think Karen was the one that asked that question at a meeting, whether I was eligible to vote or not. As an alternate representing Archuleta County, if the main person there was not in attendance at that point in time, then the alternate should have actually assumed that position of having a voting factor and protecting the monetary side of the organization that they're protecting. So in the bylaws, it was stated that an alternate does not have a voting action, which I strongly disagreed with at that meeting. And I expressed to them, well, to not them, but to the health department that I believe I should have a voting factor in that. And what was stated to me was the bylaws. I mean, it was several months. Michael looked into it, and several months later got the answer that in the bylaws, it was not allowed. I also got a response stating from that it was a statutory requirement. And I looked into that, and I also had our county attorney look into that then, that it's not statutorily required. It's mere just the board changing the policy. And I asked for that to be done, and it hasn't been done.
Well, I guess actually Commissioner Mays, that one, I think if we could redo that, and maybe it would be that we would have tabled the items that needed to be decided that day while we figured out how to deal with that situation, because I don't think any of us expected it to arise. So I apologize. If we could do that again, where we just tabled the meeting, figured out how to respond to that, we would have. I also think that we have never had, at least since in the years that I've been around, we've never had a contentious vote where we've had it 4-3, or I can't even think of a time where we had it 5-2 or anything like that. So a little of it might have been complacency on our part because most votes have been unanimous. I guess I do think there's some difference of opinion between lawyers, and perhaps we could ask the lawyers to work together to resolve this issue. And because I'm not sure that they have communicated further on it. I know that Michael Goldman provided a response to that last November when there was a question on it. And could we ask them to offline come to some discussion about that so that we can let that be resolved by legal people?
I think that would be advantageous.
My spare time.
Yeah, and our county attorney is pretty tasked right now.
Yeah.
But I do think, it's high time we start moving on that. Especially if one of the votes was to come up as a monetary decision that's going to affect both counties. I think even if the alternate's there, that county should have equal representation in that matter. That's the main important thing, is the reason I asked and questioned that in the first place.
And I guess, and I'm just, again, thinking ahead about the point, and I understand your point. So if it turns out that a alternate can't be appointed, if somehow the statute indicates that, it seems to me, if a county commissioner can't be present, we should move the meeting. That's the so appointed person.
Right.
Okay.
So if I may ask, or make a couple statements and then ask a couple questions, if that's okay with you.
You bet.
So without going too far back into historical data, because I think from my perspective, I'm looking at moving forward. Again, maybe, but I think there are some important things that we need to discuss that are either perceived or real, that have come up and I think have just exacerbated a potential roadblock in the relationship between San Juan Basin Health and Archuleta County. And I think one of those would be the perception of equitability. Equitability in the care that we receive from San Juan Basin Health, and equitability in responsiveness from San Juan Basin Health when we are in need of your services, whatever that may be, whether, if that's pandemic related, if it is other issues that San Juan Basin Health covers. I think that there is a perceived, rightfully or wrongfully, view of inequity in that Archuleta County is kind of the second chair. We get maybe what's left. If there are enough folks to go around, we may get somebody to respond to Archuleta County, or we may not. We may get a phone call returned to us if we leave a message. We may not. And I'm speaking of these because these are things that I specifically know of, that I specifically was involved in. And I think it's important to point out that, and I'm sure all of you can appreciate this, a partnership means an equal give and take, an equal preference to all of those that you serve, in this case, Archuleta County, La Plata County, and San Juan, and equal responsibility. I believe that we as a county have a certain amount of responsibility for not following through. We have a certain amount of responsibility in general for where we are today. But where we are today is not where we want to be tomorrow. And so I think it's important that we talk about the elephant in the room and these perceptions of our community, of our professionals that work with San Juan Basin Health. And if you would like specifics, I can provide them. However, I'm not sure that's necessary for the purpose of our conversation today. And I would like to hear your responses if you would, please.
Well, I'll start, but I certainly think this is open to any board member to respond to. And of course, we have Leanne Jalon that's with you all that can also respond. I'll tackle the first item, the opposite of what you said, the responsiveness. I know from having spoken with you, Commissioner Brown, you indicated a couple of circumstances yourself that had happened in the past where you had some good experiences and then where you had some lack of response. And I followed up on that, but I didn't have any specifics. And I learned from Leanne that there is a specific process whereby they could follow up on any such thing. They actually have a fairly sophisticated phone system that tracks all calls and where things went and where something got dropped. I know in the work that I do when I'm not volunteering on a board, we have to have a similar process because sometimes people have not gotten the service they've expected, and we've had to follow up and figure out what it is and work that caused that. I do think that regular communication between us will help assist with that, and understanding processes will help assist with that. In terms of services, we spent a lot of time on this at that meeting. It was at the very beginning of the meeting that we had, the 90-minute meeting we had with the investigative committee. And we did give them an overview of what information is always out there, that around September 1st every year, Public Health provides each county with an annual budget request, and that summarizes all the services being delivered in that county. We did summarize that, I think it's around October 1st, thereabouts, San Juan Basin Health presents the budget to the joint session of the county commissioners and walks through the statutory foundational services that are provided. And then in each board meeting, we walked them through board packets. I don't think we walked them through a board packet, but in every meeting, we have actually approved, the board approves the programs. So like today, when our board meeting occurs, we have several programs we approve. They're 1, 2, 3-year programs, depending on the funding, and it describes the program. It describes in what counties it's being provided. But in terms of your question about what is equitable, the statute requires that we have proportional funding, and the effort has always been to be sure that there is fairness in proportion to the population of services being provided. And Leanne could tell me the exact number in my brain. It's 82 or 78, 22, something like that, proportional population of the counties. But we walked through all the services that are provided. We talked through each one. I mean, we started with communicable diseases, and we walked through what services are provided in Archuleta County and the proportion to La Plata County. Then we walked through environmental services and we talked about exactly what services are provided in Archuleta County and how they are delivered in proportion to what is provided in La Plata County. So we did walk through all of that. So I would believe that when you get your report from them, that initial part of the conversation, I actually walked through a summary of all the services delivered. And if you would like to receive yourself a full presentation of that, I believe that there is staff that would be very happy to just walk through all of that with you. It would take, I mean, I could give you a 5-minute overview, but I think for you to get a really good feel for it, it's probably an hour presentation from staff.
Okay. And I'm referring not just to numbers, but actually having people here in Archuleta County from San Juan Basin Health physically here. And it's important that our constituents see people from San Juan Basin Health. They know they're from San Juan Basin Health, and they can equate the service, whatever it may be, directly to San Juan Basin Health. So they're seeing, in essence, what they're receiving for the money that they're paying.
And I understand, and I guess I would say, I do think you should hear the presentation so that you understand sometimes public health is not the same as delivery of personal health that like happens at a hospital or at an outpatient care clinic. And there are some elements of it, they're minor in public health compared to what is your typical delivery. And so it does present different things. You know, restaurant inspections that people aren't necessarily in a building. On-site wastewater inspections, people are not necessarily in a building. So I would ask that you also consider that element of it too. But I hear what you're saying.
Thank you.
Commissioner Brown and commissioners, first of all, I think this is a really healthy session we're having. And as I met all of you at CCI in June, and the first thing I said is I understand the process you're going through. And certainly as commissioners, I think you said it when you kicked this off, that you're wanting to look out for the best interests of the residents of your county, just like I'm doing in my county. I really think the elephant in the living room is a good thing to start on, because I'm hearing there's some past things dating even back 5 years ago that we have an action step today to look at. And again, what is statute? This is a unique, it's not a typical nonprofit in the sense of we are bound by so many statutes, but I'd like through this process to see a list of what are the specific concerns, what are the specific things that are solvable, and then what are things that are perhaps not solvable, or just another bucket of things that might fall into the category of, just like what Ann was saying, that it's not a typical healthcare entity. And so maybe there's just some education to be done, but I support this dialogue. I'm not going to go on record today to say it should go one way or another, because you're in a process. As representing La Plata County, I mean, we're willing to open up lines of communication to the extent I can as a fellow commissioner. And, I think one thing I would ask is that we just stay with specifics instead of, sort of getting into ideology or things that we can't really control that much. But let's look at, are they process issues? Are they statute issues? Are they service issues? What is the list of concerns? And then are they solvable by staying together, or are they solvable by not staying together? And, I think this meeting is very healthy. And if we need to even have more of these or regular, I'm certainly willing to spend that time, meet you in Bayfield, come over there to Archuleta County, whatever we need to do just to have a good understanding of what you are experiencing, and then what is in the best interest of not only individually both our counties, but also our region. There's, I think, a regional issue here too. So I don't know that I'm not coming forth with any answers now, but just when do you see wanting to conclude this? I think, was it January, February? that you're going to be bringing a recommendation back from your committee?
So what we tasked the committee with doing is to provide us with a response within the first couple of weeks of December. Of course, we have the ability to extend that if we need it, but I did not want to drag this out any longer than it was necessary to find the information that is needed to make a decision. I don't think this has to be a year-long study for sure. So that's why we gave it a specific time period with a relatively, what was it, 90 days roughly?
I think it was.
Somewhere in there.
And are they just coming back to you with a straight up leave or go, or are they going to come back to you with proposed solutions?
Well, to be honest with you, I'm not exactly sure, but what we asked them to do was to make a recommendation based upon what they were able to collect on how we would best serve our community, whether that's by staying with San Juan Basin Health, again, leaving, having our own health department, or potentially considering another health district.
Okay. Had you.
And also, if I might address the not hearing back from the committee, I know that Musha had not been feeling well for a couple of weeks, so I expect that's been the delay in hearing any follow-up.
Yeah, no problem.
Ronnie, do you have anything?
No, but I saw Karen's lips moving, but I didn't know if she was wanting to speak or we didn't.
Oh,
hear her.
no, I just said no problem about
Oh, okay.
about that. Yeah.
Okay.
So I do have a question. If this committee is not going to make a recommendation to you until late December or January, how is that going to impact the county's contribution for the 2022 year?
I don't believe it will impact it at all because
Okay,
we have an agreement. We have to give written notice for a year prior
Okay.
to term meeting.
Yeah.
all right,
So it
thank
should-
you.
it shouldn't, yes.
No, so there would be no impact on the 2022 budget.
Right.
Yes.
Okay, thank you.
So I have a question, if I may. So when we're talking about communication and improving communication, I think it would be a good idea if we were to have some regularity in meeting, because I've never come across a time in my professional life when too much communication occurred and it was a bad thing. But to that end, I'm wondering if San Juan Basin Health might consider adding a health department staff member that is employed by Archuleta County, that answers directly to Archuleta County, that reports directly under Ms. Jolin, that may help the board in, I guess, translating what is going on from technical terms in more of a layman's,
Understand.
a layman's terms. So all of us understand what is happening, because not having a medical background, not having a health background and training, sometimes I spend a fair amount of time researching to make sure I'm understanding what is being said. And I have to tell you, I'm sure I don't get it all. And I would see this maybe as an opportunity to that we may have a better understanding of potential changes that are coming up, new programs, decreased programs. And it would give us that ability to actually have a staff person that's actually involved, not just a board member who attends the meetings and gets the cliff notes of what is actually happening on a day-to-day basis.
That's a very operational thing that usually as a board member, we wouldn't be touching. My legal brain has a lot of questions about and how that would work. But to me, I think that's a discussion point for sure. I don't I don't even know quite what I don't think I can visualize enough from that overview to even have a response yet. I mean, I don't think I understand, but if that, even if that is something, if you were looking ahead and saying, we think we want to transition away and we need someone in to shadow and follow what's going on, so we understand what we would be transitioning, that the answer to that would be, of course, if you decide to provide your own department. To me, I think everyone at Public Health would make an independent, or whatever decision got made, everyone would make the effort to make sure that absolute best transition occurred. But if you're saying, if to have an ongoing relationship, that is a piece that works, you know, there'd be a lot of detail about what does that position look like, where would they be, what do they do, and then all the employment things that go with that. I just have questions, and that to me would be for people to figure that out.
Well, honestly, I wasn't looking for an answer, but I did want to present it as food for thought, and I think it could have twofold. I mean, if the county, if Archuleta County decided that San Juan Basin Health was not the best option for our citizens at this moment, we would have a person that is very familiar with the health district and everything that's going on. But that's not my main reason for asking the question. Again, it is to improve communication and understanding, and have a very firm understanding of what is operationally, what is going on, how are things done, that we might better understand and support from Archuleta County's point, San Juan Basin Health. And I don't know how it would look, honestly, and with the legal end of things. It's just, you know, trying to be creative and look for solutions instead of, you know, beating the drum about past things that have come and gone. I'm just looking forward on how we can do this better together.
Right, and and I'm making the assumption that you're aware of all the programs that get passed. I'm assuming Alvin reports back to the commissioners. Commissioner Schaaf reports back to the rest of you on the things that happen at the board meetings. I think you're talking about pretty detailed operational things that you're asking about. And I'm not quite sure how to do that, but I'm sure people can have a discussion about that.
Thank you. Just a mere statement. What I'd like to make is, you know, whether I know we're close and we're neighbors, but we're not the same. A lot of people say that we tend to be the same, but we're not. Our culture is different over here. It's different in La Plata County, and I don't expect us all to be the same. But I think it would be important for somebody from our area to help represent the same type of culture that's over here as well as over there. And then this way we can level off the playing field and have a better understanding, because I don't think our cultures are the same. They're not.
So I have a question and just a comment. You have representatives on the board from your county. And so I'm not really sure whether you're asking to add another person to the board, or that there's equal representation on the board, because you do have representation on the board currently through Karen Daniels and through your commissioners. So are you asking for another person from Archuleta County who would be not on the board or outside of the board? I'm not really seeing, I guess I don't really see what the role of this person or persons would be.
So what I'm envisioning is to have a person that's actually operational, that works with San Juan Basin Health. Again, that reports to Leanne, excuse me, Ms. Jolin, because there's always a disconnect between operation and a board. I mean, try as hard as we may, there's always a portion that's going to be missing because some things just don't translate. And I'm just wondering if that might help us collectively understand and to be a part of San Juan Basin Health, because I can tell you, I don't feel like we're a part of San Juan Basin Health. I mean, we pay for the service, we receive services, but I don't feel like we're a part of it. And I think that is not that unlike the feelings that are shared with other folks in Archuleta County. And I think we need to be a part of San Juan Basin Health, or more of a part. And I'm just looking for that missing link.
So does that necessarily have to be someone who is employed by you, or could it be someone who already is employed by San Juan Basin Health and just provide more information through that individual rather than, I guess my question is, do they have to be employed by you, or could there be an existing person in San Juan Basin Health? It could be Leanne, for as far as I know, who could meet with you to discuss operational pieces of the institution, as opposed to having to hire a whole new person to do that.
That's a good question. And I have to tell you right now, I'm very malleable and open. I just want things, I want them to be as good as we can make them. And however that's done, I think we're open to that, or at least I'm open to that.
Okay.
And I think I'd just like to say, I think, again, this is productive in the sense we have an idea for a solution. We've had two ideas that I've heard so far. I might have missed a couple. One is to look at that idea of, I think we sort of concluded, not that this is a decision-making session, that in the future, when big items are being decided upon, if one of the commissioners from either county can't be there, then the meeting wouldn't occur, because it sounded like there was some heartburn from something that happened before that Commissioner Mays raised. So that seems rather solvable, actually. If we can't have an alternative vis-a-vis the statute, then that's a policy we could have. So when big funding decisions are being made, we wouldn't make them without both of the commissioner representatives. Also heard just this idea of studying the equity of who's getting what. I think that's actually a really fair question that you all are asking. I understand from reading my board packet last month, not very easily answered, because not all of San Juan Basin services are broken out perfectly by, oh, we know that of this many whatever being provided, this many are Archuleta and La Plata, because that's not the way the reporting or the grants work. And of course, there's people here that know much more about that than I do, but I think it's a fair question. Where I hear Commissioner Brown going is just back to this idea of communication. I hear helping you understand public health and health in general. I hear, thank you for saying you're open to different avenues. Is it a new person? Is it, what does that look like? But I think certainly there should be a shared interest here that any set of commissioners should always feel that they have through, whether it's board packets or liaison or whatever, there's got to be an avenue to get people up to speed, especially if you are perceiving that you don't have enough information about how San Juan Basin is impacting your community. So I just maybe would register from a process perspective that let's put that on the list, that we don't exactly know all the ramifications of either hiring a person or whatever. I also would say that Commissioner Schaaf and I are in a process of appointing somebody to be on the board. And I think that's a really important process. He and I talked this week, and to get to Commissioner Mays' issue about cultures. Cultures are not monolithic. Our culture here in La Plata County is very different. Mm-hmm. I don't think we can say culture. There's one culture in La Plata and one culture in Archuleta. That's not the case. Right. And cultures mean different things. It could mean ethnicity or income or, values and all of that. But I really hope that you all, because your people over there, can really get a good slate of candidates for us to assess. Because that will be very important to get somebody in there from Archuleta County in my mind, and then somebody that can, really liaison back to all of you. So kind of going on a little bit too long here. I just appreciate Commissioner Brown, you putting that idea on the table. I don't know that we're going to know how to get there today, as you point out, but what I'm hearing is you want to know more what's going on. And there is a translation issue with public health and people who are not in public health. I'm experiencing that myself as well. Just, this is a lot of new content, and if you're not in the health field, it does require some extra time and energy, I think. And I look forward to hearing from all of you and the Solutions Committee, other solutions. What else can we do to improve communication?
Well,
Seems like
I
that's
think,
one of the big problems we're having here.
yeah, and I think, you know, whether it's a person that's already employed from San Juan Basin Health that's from here or that lives in this area would help bridge that section there if they directly report to about the area here and what's going on here. And I don't even know if that's already established or not, or if it's just a weekly discussion that they might have. I don't know the semantics on that. But I think with what Warren Brown was trying to say, or even saying, was that we do need somebody from here that understands here to report to Leanne about what's going on or what the cultural differences are, if there are any, or if, you know, what kind of semantics that might play into this bigger part of the role. And it opens up more communication.
So again, I ask, you have direct access to Leanne. Is there a reason why, if you guys know what those issues are, why you can't talk to Leanne about those issues? I mean, you are the commissioner who is a part of the board, is Leanne's employer in part, and
you know, what I would like to say is Leanne's a very, very busy lady. She has a lot on her plate, as we all know, and we've seen it, you know, even with her award-winning background. I mean, I commend her on her achievements, you know, but the thing is, you know, sometimes when you're super, super busy about what you're doing and focused on, some things get dropped out. And I mean, even the best of us, it happens to us all. We don't always see it coming.
but that again is a communication issue that you all, between you and Leanne, need to.
Well, Sherry, I communicated about if we want to get into the details of it or the weeds of it, I really don't want to right now.
No, it's okay. I'm just trying to understand whether it's a lack of ability to communicate. And again, I understand that Leanne is a very busy person, but she meets with La Plata County once a week, and she doesn't meet with you guys once a week. So it's not an unwillingness to communicate. So I'm just trying to understand, I guess, the root of the communication problem.
Well, the possibility if she had a representative from here meeting with us once a week, that would be good under her supervision.
Well, and
Well, let me ask
that's a reasonable option. I'm just trying to understand exactly what the problem is.
Let me ask a question, if I may. We have an office in Pagosa Springs,
Bob Ledger.
and I can't remember how many employees there are over there. But do you ever communicate with them, or should one possibility might be that one of the individuals that are currently there is designated as to directly communicate with the county board? I mean, we have an investment over there.
No, I agree, Bob, and I think that's a great suggestion. I think that's exactly what the two commissioners here were suggesting. Somebody like that who would communicate with us on a regular basis. Somebody who actually lives and works here, has their pulse on their thumb on the pulse of the community.
You know, I'd like to say something else here. You know, we're sort of dancing around a lot of issues here, trying to be polite with one another. I mean, I was the chair of, you know, the board for about 10 years. And quite frankly, we had a lot of complaints from people over there that didn't want our services. They thought we were intruding, like restaurant inspections, sewer connections, things of that nature, which I was sort of astounded by. But I understand the cultures are different, unquestionably. But again, if it's a communication problem, I think we can address that, perhaps, as I suggested. And the other thing is, if you want to know what's going on at the board meetings, you do, as has been pointed out in earlier conversations, you have a direct appointee and you have a county commissioner. Maybe we should be having more meetings over in Pagosa Springs. We did for a period of time. And quite frankly, there were no members of the community that attended, in my memory. So I don't mean to be harsh, but I'd like to get, what are the real problems here? We can address these. 10-4, I'm out.
Thanks.
Well, you know, Bob, the other thing is we have an investigating committee going into this and looking into this. So we're careful on the bounds that we're going to step, because we don't want to influence nor deter their direction. So we want to see what this committee comes up with. That's why we're not getting into the weeds with things.
I just have a question about that, I guess.
Are you going to get in the weeds with things?
Oh, sorry, Bob, go ahead. I'm sorry.
I was going to ask the question. Who's going to get in the weeds?
Our investigative committee is looking into the details and some of the issues and raising some of the questions. That's why we have a committee.
Are any members of the board on the committee?
Nope.
Okay.
We want a fair and equal feedback from that committee. I think if a commissioner was on that committee, it would be biased.
Okay.
So question I have, are any of them listening in today? I think you can look at the Zoom thing and see if they're listening in, first of all. I think it's important they hear these concerns. I know they probably already heard them.
They are.
Okay, that's good. And then secondly, I would hope that they're taking these ideas around solutions and batting them around and going under the hood. Because I'm hearing you want more of a, I'm not going to repeat myself. You're wanting more of a connection and you want, more of a San Juan Basin presence in your own community. So let's note that and then have somebody get under the hood about the methods that could happen. So, I'm glad they're listening in. For those of you listening in, I'm glad you're here today. Thank you for your time. And, but I think Mr. Ledger raises a good point. Let's hit on what are the real issues here, not dance around too much, so that we can start to get a list of what are the real problems and do we have any ideas or suggestions for solutions that committee can use in their deliberative process.
So basically, we've discussed policy, personnel representation, cultural differences. Have I missed anything else? Communication. I mean, what more do we need to do? We pointed out these issues even to our investigative committee.
Well, could I ask another question? Because I'm really curious about this. I recognize that there are differences in culture, but how do these things manifest themselves? That's what from your perspective. When you say cultural differences.
From complaints from our constituents, Bob.
Well, for example, we heard from a lot of them about the COVID thing and the masking thing.
Well, that isn't the main topic of things.
Well, what is the main topic?
A lot of it is about the fees for the septic design fees. There's probably other alternate solutions for that. But it doesn't have to be a one size fits all. I know there's different soil types. There's many other different things.
Well, have these ever been brought up to the board?
Yeah.
I can't remember them being brought up. The only thing I can remember
I remember a lady going to the board and asking to speak to the board when I was sitting there as an alternate, a non-functioning alternate. When I was sitting there, and yet the board president chose to question her what she was doing there. And she was a constituent from Archuleta County. And it's a public meeting. She has every right to be there. She has every right to speak and question. And she wanted to question and discuss the septic situations and the other all possible alternatives and everything. And the question she got is, why are you here? Why didn't you talk to staff? Well, she tried. Her other alternative was to go up the ladder, just like everybody else. That's a communication problem, Bob.
Was I the chair at the time?
Possibly.
And I remember having conversations over there about the septic system and the inspection.
This was in Durango at the San Juan Basin Health Office in Durango.
Well, I don't remember that.
I could get you her number.
Well, was the issue resolved? No.
No, still not.
Well, has it been raised by anybody since then to this board?
I believe it
I
has
can't
been,
remember.
but if the person went to the board, they went to the board. They went to the head of the solution. But Bob, you know what? We're getting into an argumentative situation, and I don't think this is going to go anywhere other than we're going to beat this to death.
Okay, you're right. But I would just say again, if it was an issue, a burning issue over there, maybe there was one event that you brought up, and maybe it was resolved, maybe it wasn't. I don't know. But if it's an ongoing issue over there, it's incumbent upon the representatives from Archuleta County to bring it to the entire board's attention. And I can't remember this becoming a burning issue.
Well, you know what, Bob? You may not remember. I remember it. We hear it from our constituents. The thing is when it doesn't get addressed or resolved or get some type of solution or answer sent to them, it's different. Then they get dropped by the wayside. But I can, Bob, this conversation is not going anywhere, my friend.
I'm going to ask a question that possibly redirects.
Yeah.
I think that what I'm hearing is the septic issue. I will admit I need a briefing on this. I know we have state rules that guide things.
The expense is what we're looking at.
The expense. So can we put that on the list to see if there's any problem solving? If this is about septics and fees, what are the choices? Maybe there's no choice, but to keep it like it is. And I share your view. We don't want to get too much under the hood today. But I think what's being asked here or talked about is when we say cultural issues, what does that mean? What does it mean? Are we talking culture around regulation? Are we talking ethnic culture, in which case there needs to be something done differently around just how to outreach to different types of communities? Are we talking, we know that we've had a lot of culture wars, as it is stated, over COVID politics. What are we talking about when we say culture? Because it gets back to what Commissioner Brown said about the elephant in the living room. If this is one of them, it needs to be talked about and defined. Because when I hear different cultures, I don't hear specifics. And I'm not trying to be combative about this. I'm really not, commissioners. I'm just saying if we're going to solve problems, we have to know what the problems are. And I hear, okay, fees for septic approval and all of that. Is there any decision space around that, or is it just is what it is? Can we solve that? So I think that's important for the investigative committee. If you all decide to leave, which we have acknowledged that, that's your right. And it is because of cultural issues. I'm just speaking as one commissioner. I would want to have those stated what that means. Because that will help us, I think, open up lines of communication. It's just kind of a basic definition.
And I'd just like to point out that fees are voted on by the entire board. And so your representatives voted unanimously to include the fees for septic. And if that wasn't what Archuleta County wanted, then the vote should have been a little bit different at that time.
I don't know necessarily, fees wouldn't probably fix everything. In reference to the septic, what I've experienced from the community is maybe a perceived or real unwillingness to have any flexibility on, what's the word I'm looking for? Well, how we administer that. Can we, and I can't speak for the other two commissioners, but maybe the board here could absorb some costs. But we have a lot of people who just can't afford to put in a septic. They can afford the house, but they can't afford the extra $20,000-$30,000 to put in the septic. So maybe if San Juan Basin or the Board of County Commissioners here could, we know there's only so many soil types in one area, and whether it's 10 or 15 or whatever, absorb the cost of having those engineered plans already available to the public without adding that extra cost to them. I think that's been a huge, I've been approached by, I don't know how many people in reference to that.
So that is a cultural issue, having different socioeconomic,
Yes.
having those differences across the two counties is a huge cultural difference.
And I know that it's possible, sorry to interrupt, it is possible. I know Park County does that for their citizens. So, I mean, maybe that's something that we can discuss and maybe facilitate.
So you're not saying you well, and again, I don't want to take us down a rabbit hole here, but just to note, there's what the regulations are and then what the fees are. I'm hearing what you're saying, a concern of, that is a lot of money, you're right. And just for the record, there's a lot of people in La Plata County that would have a difficult time paying that as well.
Right.
We have many, I think 75% of the people in our entire region are could qualify for workforce housing. So we have a lot of people in this region that are stretching to pay their housing and their building costs. But I'm not hearing an issue with sort of what is required, like how a septic goes in and regulation. I'm hearing an issue around fees.
Yeah, the state has the requirements. There's no contesting that. We understand that. But personally, I did talk with staff, and it's been several years in reference to, and they're just like, no, that's just the way it is. I think there's just an unwillingness to, whether it's they don't know what the proper channel is, or they're just don't want it. So I can see it get from the constituents where when they can approach it, they're getting the same feedback. So like, it just goes back to everything that the both commissioners here have said, and myself, communication and a willingness to be partners. I think in the overall scheme of things. Because we're paying for services. And I know we have a representative on the board. When it comes to voting on budgetary items, I have never had an issue with any of that stuff because it's benefit hopefully overall. But when it comes to what our constituents feel that they need from a service, we're paying for a service. We're just asking for maybe a little bit more flexibility and a little bit more willingness to work and address problems. Is that fair?
Yeah. Yeah, I think responsiveness, when one of our constituents has a problem or a need of a service, that we get a response from San Juan Basin Health. And if that requires an in-person response, that it's in person and it's timely. I think that has been a challenge at times.
So if I circle back to some of the things, and Marcia Porter Norton's already done this quite well, but if I think I heard some things that we agree have come out of this work session for today, it's that legal counsel in Archuleta County is available. We know he has a dual role right now. We'll look at the issue of board alternates, and in the interim and in the absence of any resolution on that, no action items at board meetings, although we would have to pass a budget, but no action items at meetings, we think, and we're not making decisions right now, but these are things I'm hearing that we would talk about, no action items at meetings without commissioners present, and we would probably have to work through the details of what would be hamstringing if there are budget deadlines and things like that. I think we're talking about trying to have more regular communication, more meetings between us, and that's all contingent upon what your group recommends to you, but more meetings between us. The commissioners have asked for more detail about what happens internally. One of the first things that I brought up was staff presentations to you all. I know that's your time, but I do think that gets you the full range of understanding what's happening. a full opportunity for you to say, and by the way, we called about this, we know this happened and these things aren't happening, and where are you on this? I heard separate and apart from communication that you feel the need to have a sort of, on the cultural issues, an intermediary between staff and a specific representative who lives in Archuleta County. Haven't quite figured out how that might work, but the discussion of that. And then obviously we're talking about the big picture thing, which is detailing out what are the exact pain points for Archuleta County that might not just neatly fit as cultural, but what the details are that really bug you, that we could figure out, are these solvable or not? And I realize your group is looking at that, but we should be endeavoring as well to see if there's a way to solve. And we are open to that, I guess, is the communication.
One other item maybe might need to be given some more thought was probably term limitations for board members too as well.
And I think there's somehow I think there's a statutory thing that it's 5 years. So if you're talking about 2 5-year appointments, or I don't know what we're talking about, but that can certainly come forward. I think the term is not what is normal in our world, right? It's not
right. Normal is 4.
Yeah, I think it's a little weird, but I think it's 5. In fact, I'm thinking about myself. I'm coming to the end of 5 years, and I'm term off in a couple of weeks.
I guess I have a request, and I don't want to get out of my lane here. We're in different counties, right? But because we do have members of the committee on, I would want or hope or make a request that, now that we sort of are getting more of a full suite of what the issues are, and you did a great job, Ann, of summarizing, thank you. That the committee, and it's your process. So I'm just throwing this out as an idea of, like, instead of coming back to you saying straight up or down vote within your 90 days, if they're willing to come back and say, I just wonder if we need one more set of meetings or negotiation before a decision's made, because if they come back and say, here's these 5 issues, so septic costs, the governance issues, the equity issues, how to get more of a local influence, the whole thing you were talking about, Commissioner Brown, just basic communication, like Ann said, and Commissioner May said, just under this guise of cultural, but what does that mean? That if they could come back with solutions, and then our board looks at the list and says, yeah, we can agree with these solutions. So it's a little bit just, I'm not trying to add more time on. I am sensitive that you didn't want this to go on forever, but I guess I would just maybe just put that out there as an idea is, can we have a list of what the issues are, what the proposed solutions are, and then have one more meeting or meetings where we try to come to some agreement. And then if there's a parting of the ways, we did that step of looking at what some solutions are. But again, this is your process, just throwing it out there for brainstorming.
Personally, I don't think that's a bad idea. I think that would largely depend upon the board's schedule. I know that was I think our biggest challenge with the committee was finding the time that you would be available. So if that's a direction that the board wants to go, I can certainly direct the committee to head that way. But we have essentially 4 to 6 more weeks. So it would have to be something relatively soon. So if you could make yourself available, I expect the board would make themselves available, or the committee would make themselves available as they can.
I'll make the time.
I would.
I will speak with Moshe and see if we can't make that happen and schedule that out, within November. So we hopefully are able to cross that bridge. Thank you for that offer.
So I guess for myself, I just want to say thank you for a candid conversation. And I'm in agreement with something that Commissioner Brown said. No one has ever suffered from over communication. And we are suffering right now from under communication, quite clearly.
Well, I appreciate everybody's time, everybody showing up. We're a little bit over, so if nobody has anything further, we'll go ahead and adjourn.
Thank you.
Thank you very much, you all.
Thank you.
Thank you all.
Thank you. We'll be in touch.
Thank you.
Thank you.